I'm Harris Faulkner.
I'm Greg Gutfeld.
I'm Janice Dean, and this is the Fox News Rundown.
Wednesday, December 30th, 2020. I'm Chris Foster. It's a dark period of the coronavirus pandemic, but Fox News medical contributor Dr. Marty Makary sees a light at the end of the tunnel.
I anticipate that we're going to probably hit those herd immunity levels in March, and that April will be the month of massive deceleration of the infection.
I'm Dave Anthony. Today we look back to a time before COVID was a pandemic. Our first glimpse at life in lockdown in China. Little did we know then we would be living it here.
Biggest concern is food shortages and civil unrest, not so much the virus.
And I'm Cal Thomas. I've got the final word on the Fox News Rundown.
335,000 coronavirus deaths have been reported in the United States now. Hospitalizations are at record highs, more than 121,000 currently. In California, there are patients being put in tents, conference rooms, even gift shops. Governor Gavin Newsom says about some of the nurses tending to twice as many patients as usual.
Absolute expression of admiration, respect for our nurses that are asked to do more with less staff and less support. It's heroic.
Meantime, more people are getting vaccinated, including Vice President-elect Kamala Harris.
Thank you. There's no cheating. I barely felt it. I barely felt it.
But the number of doses shipped to states has been lower than projected, and the goal of having 20 million people vaccinated by the end of the month is not being met.
We've had a lot of problems in the last 10 yards of the distribution.
Dr. Marty Makary is a professor of surgery and health policy at Johns Hopkins University and a Fox News medical contributor.
That's for a lot of different reasons. One, first of all, the real world is always more complex than we'd like to think, right? The CDC issued their guidance on who should get it on December 20th. I mean, that's 2 weeks after the vaccine was shipped. And that left hospitals scrambling as to who should get it. It left states scrambling. And so that created a lot of confusion. Even in the general public now, people are wondering, where should you go and what should you do? So that has been an issue.
It looks like coming out of Thanksgiving, we got some spikes related to people visiting each other's homes and not others. Now that we've just passed Christmas, do you think that it was just luck or better compliance in certain areas, or what? Are you worried about a Christmas fallout?
Well, it's unclear if Thanksgiving really accelerated things because we've seen a gradual increase through Thanksgiving. And so the 10 to 15% increase that we saw in most states after Thanksgiving in the 3 weeks following may have been the normal distribution curve. Now, it also means that people have not adopted good practices as they should to really stop the spread. But right now, we're starting to see a plateau, and it's unclear if that plateau is the sort of the peak of this number of cases, or if it's just poor reporting from the holidays, which we traditionally see with weekend reporting. I'm hoping that it is a true plateau. And I'm hoping that people have learned some lessons. You know, people are all sort of getting religion the hard way. They're hearing about somebody, you know, it starts with my friend's dad or my, grandmother tested positive, and then, then she has symptoms, and then she's in the hospital. And then there's something unfortunate or a close call or a tragedy that sort of gets everybody on board. So that's happening to families all over the country right now. And I think people are coming around. It's just unfortunate how they're doing it.
Tell me about the mutated strains. We're told they're more contagious, but not more deadly. Is there a scientific reason to worry the vaccines won't handle them or whatever else comes along?
Well, the current vaccines appear to encompass the new mutated strains, but I am very concerned about the new mutated strains because it means that the velocity of transmission is going to be a lot higher. That is, the vaccine's going to be stickier. It's going to be more contagious, and it's going to rip through society faster. So that is a concern. But the current trajectory, the rate of mutations that we're seeing, remember, first we saw some in New York, and the virus was a little different from the virus that was in Seattle. And then we heard about a different strain in Europe than China. Then we saw mutated strains in Houston that were a little more contagious. And so what this tells us now in the UK, where by the way, 6 out of 10 infected people with COVID have the mutated strain in the UK. So it spreads quickly. It's what we call selective pressure. That is, a more contagious strain will dominate the population faster and crowd out the other strains. It tells us that this thing is going to continue to mutate. Coronavirus is going to be with us for a long time. And at some point, it may mutate around the current vaccine. And that's why people talk about maybe coming in for an adjustment on the vaccine, sort of another vaccine shot every 2, 3, or 5 years, like we do for seasonal flu.
Yeah. Should the millions of people who've been infected need the vaccine, or at least should they get in the back of the line?
I think they should get in the back of the line. And, Chris, I think this is one of the big messages that is not being told, that needs to be told, and that is if you've had the infection, if you've tested positive, or you've been confirmed to have the antibodies with a reliable test, get in the back of the vaccine line, because natural immunity appears to work. Now, I'm going to be very honest with you. The old medical establishment, belts and suspenders professors are going to say, no, we don't know that. But we do know that. There's no formal studies, but look at the observational data. Reinfection rates around the world have been exceedingly rare, and when they do occur, they're very mild cases. And by the way, the vaccine groups in the trial, 5% of them got the infection, although mild cases. Yeah. So it's not like the vaccine's perfect immunity either. Natural immunity appears effective, so if you've had the infection, step in the back of the vaccine line for now until we can study it further.
Okay. Can somebody who's been infected then become an asymptomatic spreader? Do we know?
We don't know. Now, it's a theoretical possibility, but if you think about how your immune system is immune, it's basically triggered, so the second it identifies the virus in your body, it attacks it swiftly. So there's good reason to believe once you've got immunity, from a practical standpoint, we're probably good to go. Look, we're not going to eradicate viruses from planet Earth. And at some point, we need to let people live their lives.
Yeah. What's the status of a vaccine for kids? Have they even started testing them yet?
It's interesting that the Pfizer vaccine, they studied it in people over age 18, but they applied for use in kids who are 16 and 17 as well. And it created this big stir at the FDA and among the experts because Pfizer argued, appropriately so, that a 16 and 17-year-old is physiologically equivalent to an 18-year-old, which is absolutely true. But again, the old medical establishment says unless you have the formal studies, we're not going to okay it. So right now, kids under 18 can only get the Moderna vaccine, which is approved for people over, they only get the Pfizer one, which is approved for people over 16. And the other studies are ongoing now in kids 12 to 18. The good news is kids really don't die from COVID-19 unless they have comorbidities.
Yeah, and I guess if enough older people, and by older I mean 16 and up, get the vaccine, then that should knock down the virus enough that we don't have to worry about the younger kids, right? That's
the herd immunity we're looking for, and it raises a good point, Chris. We don't need to vaccinate everybody to really get a handle on this in the spring. Assuming natural immunity is good for at least a year or a couple years, as it is, by the way, with the other coronaviruses, SARS and MERS, then we may only need to vaccinate 20 to 30% to really start hitting that massive slowing that we call herd immunity. And then in the interim, we can go ahead and get everyone who's not been previously infected or vaccinated the vaccine at that point.
If you do the math, we might be seeing the start of a coronavirus baby boom next month. Any advice for new or breastfeeding moms as far as the vaccine goes? Is there any guidance there?
Yeah, I had forgotten about that baby boom. That's interesting. So, yeah, I think right now there's every indication that the vaccine is safe. You know, even when kids have tested positive or the moms have tested positive, we've said that keep breastfeeding. It's probably more important to breastfeed than it is to try to separate people for concern of the virus threat. So everything appears to be safe in pregnancy. Again, the formal tests have not been done, so the official answer from the medical establishment is unknown. But nobody thinks that pregnancy is a significant risk.
Okay. We've talked about these new antibody treatments before. The Operation Warp Speed people say that something just like 20% of the treatments that are in hospital pharmacies are actually being used. Is it a lack of interest, a lack of trust in it, just a lack of knowledge about them?
It's a lack of awareness, and it's also a little bit of, I would put this on the FDA approval. They approved it for such a narrow indication that it's very hard to give it to people in that specific indication, which is you're sick from COVID, and you're high risk, but you have not yet come to the hospital, okay? Well, it's very hard to get, for us to identify those individuals. So, and then they have to be proactive to go out there and tell their hospital or their doctor, hoping their doctor knows, hey, I'd like to tap into that supply that the hospital has for sick COVID patients who are high risk and not yet hospitalized. They should have made the indication broader to allow it for early infections among hospitalized patients. And that way we could have given it to people who come to the hospital sick, who benefit, like President Trump and Chris Christie. That is the ideal place to give it. But again, the old professors of the medical establishment and the FDA have decided to keep that indication so narrow. And as a result, we have a lot sitting around, and there's poor awareness around it. And I bring up the awareness point because people need to know also, if they're high risk and need the vaccine, you got to be your own advocate. You got to check that hospital website of your local hospital frequently, check the website of CVS, Walgreens, or other large pharmacies in your area, and find out when they finally release it to people in your category.
Yeah, I mean, people have to remember that over the next weeks and months, nobody's going to knock on your door with a syringe. You're going to have to take care of yourself if you want the vaccine.
That's right. You got to be your own advocate. Like with all things in healthcare, you got to be your own advocate.
All right, one more. I know there's not going to be a single national masks off, go make out with a stranger day at any point next year, but how do you think it's going to work, the timing of when we can burn the masks and stop the restrictions on gatherings? Is it just going to be place by place and we'll take it as it comes?
Well, first of all, I'm going to give you a little bit of a warning here, Chris, and that is I suspect that the medical establishment will be so painfully slow in rolling back the mask requirement that they may never do it, for all I know. I mean, coronavirus is going to be with us for years to come. There's already 4 seasonal coronaviruses. This may just become the 5th one added to that group of coronaviruses that circulate year to year. Now, it is good that if you think you've been exposed, if you have any symptoms at any point in your future for the rest of your life, wear a mask, right? That's something we should have been doing. Asian cultures have done it. We've not done it. We're a little too macho. Now we've learned our lesson. Masks help in reducing seasonal flu, which we're oddly complacent about the number of deaths we've had each year. It's a good idea to wear masks if you think you've been exposed to any virus or if you have symptoms. Beyond that, I think we need to start, hugging each other and doing things without our masks and have that personal connection. And I anticipate that we're going to probably hit those herd immunity levels in March, and that April will be the month of massive deceleration of the infection. And I think we're on track for that right now.
All right, from your mouth, buddy, that's nice to hear. Dr. Marty Makary's professor of surgery and health policy at Johns Hopkins. He's a Fox News medical contributor. He's got a book out there called The Price We Pay, What Broke American Healthcare and How to Fix It. So the New York Times best-selling author and a favorite guest here on the Fox News Rundown, Dr. Marty Makary. Thanks a lot. Hey, Happy New Year.
You too. Happy New Year, Chris. Great to be with you.
This is Cal Thomas with your Fox News commentary. Coming up.
We really have lived through a lot in 2020, and this pandemic isn't close to being over yet. A year ago at this time, think back, we never even heard of the coronavirus. And then in January, mysterious illnesses and deaths were reported out of China, and then came the lockdown. Wuhan, a city many Americans never heard of that has more people than New York City, was the epicenter, and it was closed off. So in late January, we tracked down an American living and working there, stuck inside, dealing with something we couldn't imagine, not knowing we would be living that same nightmare, unaware how much worse it would get for us. Now, for me, it's one of the most memorable interviews I did in 2020. Listen to the numbers of cases and deaths. Back then, they seemed like a lot. Now, it's an interesting snapshot of a time when there were no masks here and life was still normal in January. It's an outbreak that's hit China hard and reached other countries too, including the U.S. The coronavirus and the number of people infected grows every day. Thousands sickened. More than 100 people have died. It has sealed off parts of China. Transportation halted, including airlines like British Airways, Lufthansa, and United canceling some flights to and from that country. Now, one plane, chartered by the State Department, did fly 201 Americans out of Wuhan, the city at the epicenter of this Chinese outbreak. It landed on Wednesday in Riverside, California, where they'll be in quarantine just in case, even though they all passed health screenings and were virus-free when they left Wuhan.
We did submit our personal information to try to get on the flight. I understand that some families were offered seats and had declined. We were not offered seats.
Samuel Roth lives in Wisconsin and is still in the U.S., but his wife and 2 young daughters are stuck in Wuhan.
You know, they can put some masks on and go outside to walk to the grocery store and pick up food. We're just trying to be vigilant that everybody who goes in and out washes their hands, keep the home clean, and kill the virus if it comes into the home.
Doug Perez is another American who is living through the nightmare in Wuhan, where he's a teacher in an English language immersion program.
I'm with my girlfriend, her brother, and our Labrador, Chubby. Chubby, the apocalypse dog. So
I've seen pictures of Chubby. He's very cute.
Yeah, he's actually really keeping us strong, and we're keeping each other strong, and I'm keeping in touch with all the other Americans here in Wuhan, and we're supporting each other as much as we can. You know, when we're feeling down, we text each other. When we're worried, we text each other. You know, I've had friends who have broken down, and, you know, were calling me crying, and we do what we can to keep each other strong.
You can't really get together with them, can you? Or do you? Do you just all text?
All text. It's too dangerous for us to get together. And some of us are even sick, maybe even with the coronavirus. We don't know, but we can only do so much via texting, but it's still incredibly powerful with phone calls. Just thank God for social media. It keeps us in touch with each other 24/7. In fact, it's a bit maddening. It's kind of too much contact with other people, kind of ironically, you know, but we've just been keeping contact 24/7 with each other. You know, we have a network. We're looking out for each other. And I think for Americans abroad, really, politics goes right out the window. We're just looking out for each other. We just want everyone to be okay.
You mentioned that some even might be sick. I mean, if any of your friends or any of the Americans you talk to believe they are they going to go to a hospital? Where do you go now with it being such a problem in Wuhan? Where do you show up at a hospital?
That's out of the question. Hospitals are overrun. Even the government made an official announcement in Chinese saying that if you have mild symptoms, if you're a little, quote unquote, a little bit sick, do not come to the hospitals. We're overrun. They need supplies. It's a disaster. Our plan, and what those of us who are sick, we stay in, we take aspirin and ibuprofen to control the fever. And we just rest. And eventually, if you're young and healthy, your body should be able to stop the virus.
All right. So you just let it run its course then. So have you had these symptoms yourself?
I haven't had these symptoms, or at least not to this extent. I don't believe I've had it. No one in my household here, you know, the 3 of us, we haven't had it, but we have friends who have all the symptoms, and some of them were running temperatures before. Fortunately, now they're not running temperatures. We're hoping, at least I'm hoping, that they had it and they recovered, and maybe they have some immunity to it now. But we don't know. This is a completely new virus. Even the scientists don't know. It's just brand new.
Right. And my understanding is that there more than 100 people have died in China, but there are a lot of those people might have had underlying other health problems that the coronavirus made worse.
That's true. In fact, the median age is 65, and the demographic that's been hit hardest is the very old, the very young, and those with health conditions. And if you have both, you're incredibly vulnerable to this. What scientists are concerned about is if there's a mutation. And it could. I spoke to a scientist here who was here during the SARS outbreak, and I asked him, could this mutate and hit, the younger demographic hard? And he lied. He said to me, I'm not going to lie to you. It very well could mutate. Sorry. That's the
even Chubby's worried. I can tell.
Yeah, he's scared. I'll tell you a good story about Chubby, though. I don't know if you saw. We have a video of it. I'd be happy to send it to you. But at one point, a couple days ago, everyone in Wuhan, we went out to our windows and we were all chanting about Wuhan, yelling in Chinese. We are all Wuhan people, and come on, Wuhan. And it was very inspirational. And Chubby heard us cheering, and then he started barking. to coffee. This is weird.
Do you get to take him everywhere you go?
Basically, whenever we leave, we bring the dog. So we only take him out for walks. That's the extent of us leaving. The only other time we left was to gather food and stock up on supplies. We went out, we spent $400 or $500 on groceries just to, so that we can stock up and be okay. And that was a scary experience too. Guess what? At the door to at the gate to the supermarket, they're checking everyone's temperature. Everyone's temperature.
Right there, and before you even go into the store?
Before you even enter. And this is standard at supermarkets and Walmarts across Wuhan. So it's a pretty scary. We're lining up to have our temperature tested. One of those temperature guns they put to your forehead.
Yeah.
It's like something out of a sci-fi movie.
That must be a little unnerving. Now, how much did you said you spent $400 or $500. How many days of supplies was that for you?
I would say if we really stretched it out, maybe 3 weeks to a month, since there's 3 of us. We're all young and we eat a lot, and we have a dog too. So, and we bought other things too, masks, goggles, anything we could get our hands on that could, protect us from this.
Right. And what about fresh food? I mean, fruit and vegetables, those don't last forever. So do you expect to get deliveries too, in addition to what you bought at the store personally?
That actually, we were originally only going to rely on deliveries. That was my girlfriend's point. She said, hey, it's too dangerous to go to the store. Let's just rely on deliveries. We got a couple deliveries at first and everything was okay. But these past few days, no deliveries have came. And that's actually my biggest fear right now, is not the virus, but that deliveries aren't coming through. And there's always the possibility of food shortages when you have a city of now 6 million because of Chinese New Year. 6 million people, and we're quarantined. So I'm more worried about food shortages right now than the virus, to be honest.
So, talk about quarantine. As you say, you only go out to walk Chubby. So
yeah.
When you walk around, is it desolate? Is it like a ghost town? Are there people?
Desolate. When you see people, you know what they have in their hands? You can guess. Bags stuffed to the top. Packed with food, anything. They're wearing masks. They're just bringing supplies home from the market or from wherever. When you see people out, people are just going out to get things and come back. So that's unnerving too.
Are there cars driving around, or are you just walking?
There are some cars, but actually the Chinese government has, Wuhan government has banned all cars unless you have a permit for special purposes, like if one of your family members is sick and you get them to them at the hospital, or if you're in, or if you work for a supermarket, if you're in certain industries, then maybe you can drive. But they're really restricting those permits. So there's very few cars. And this is unnerving because normally the traffic here is worse than Los Angeles. I mean, there's 11 million people in the city normally. So to see a couple cars passing by on a 6-lane highway is it's unnerving. Have you seen that movie 28 Days Later?
Yes.
It's kind of like that. When the guy wakes up, he's in the hospital, absolutely no one. At some points in the day, it's just like that. It's creepy.
Now, those are like zombie apocalypse movies. Yeah. This is not that. And the question I have is there any civil unrest that you've seen anywhere in China?
Well, so far, things are okay. So far, there's enough food, and people are still very confident in the response of the government. Again, like I said earlier, my biggest concern is food shortages and civil unrest, not so much the virus. The government here has taken a very, very strict, and very proactive response to this coronavirus. So it wouldn't surprise me if there are some problems in the future, especially food shortages or civil unrest. So that keeps me up at night sometimes. I'm not going to lie to you.
Doug, how long have you been in Wuhan? Why did you go?
I always wanted to go to China. I've been here 2 years, teaching, and I came to Wuhan over other cities because the salaries were actually higher in Wuhan than even in Beijing or Shanghai. So that's what caught my attention. And I came here, I met my girlfriend, we fell in love, stayed here, and now this is where we are. That's why I didn't even consider an evacuation, because I'd have to leave my girlfriend and my dog behind.
They wouldn't be allowed to come with you?
No. Even if we were married, she wouldn't be allowed to come with me.
Really?
So, unless she's a U.S. citizen or has a green card, then she could come. But if you can be married and not have a green card or not be a U.S. citizen, so even then she couldn't be with me, even if we were married. So
and it might be expensive to get evacuated anyway, right?
From what I heard, and again, don't quote me on this, but it's the U.S. government wants you to pay $1,000 to be evacuated, and for me, that's not a problem. Again, over here, I've been, reason I like it here, I've saved a lot of money here, a lot of money. I never thought this would happen, but now I'm not worried about my financial situation in this crisis. Thank God. I just have to worry about the virus. I can focus on that.
At some point when this is all over with, will you want to come back to the U.S. and maybe with your girlfriend and Chubby?
I would love to at some point, and she has a tourist visa, so she can come by, see how she likes it, and who knows what will happen. Who knows what will happen?
Well, we hope that everything in the end works out when this is all over with. And Doug, thank you so much for your time and joining us.
All right. Thank you so much for having me. I've done a lot of interviews, but I really like this one. You guys have a great show.
Thanks a lot. Doug Perez, an American stuck in Wuhan, China in the coronavirus outbreak. Great to talk to you.
All right. Take care. Bye.
New from the Fox News Podcasts Network.
My name is Kennedy, and welcome to my podcast, which will, I humbly say, single-handedly save the world. You're welcome.
It's Kennedy Saves the World. Subscribe and listen now by going to foxnewspodcasts.com.
It's time for your Fox News commentary.
Cal Thomas.
What's on your mind?
At the 1980 Democratic National Convention in New York, Senator Ted Kennedy delivered a speech following his defeat by Jimmy Carter for the presidential nomination. The speech was boilerplate liberalism. Kennedy criticized Republicans and Ronald Reagan for their ideas, which he said were from the past. Well, today, the past is looking a lot better than the immediate future under Joe Biden and the Democrats. A part of his closing line would be good for today's Republicans to consider following the abbreviated Trump era. Kennedy said, quote, "The work goes on, the cause endures, the hope still lives, and the dream shall never die," unquote. Trump has contributed mightily to the GOP, giving the party a backbone it seemed to have misplaced following the Reagan years. He also has reminded people that conservative ideas work, including tax cuts, a reduction in regulations, and constitutional judges. Add to these significant accomplishments the Trump administration's brokering of 4 peace deals in the Middle East no one thought possible, much less achievable, and the development of a coronavirus vaccine various experts said was not possible by the end of the year. As Trump leaves office, where will Republicans go in 2024? The president has hinted he may run again in 4 years. If he wins, he and his supporters could enjoy sweet revenge. But should he be a candidate? As much as he has done for the party and the country, should Republicans put all their faith and trust in him? A lot could depend on how President-elect Joe Biden does in office. Biden almost certainly will not seek a second term when he's 82. Last August, Trump was questioned at a White House press briefing about polls showing his popularity was declining. Asked to explain, he responded, quote, "Nobody likes me. It can only be my personality, that's all," unquote. It was a rare moment of transparency for him. There's still a remnant of old-fashioned values my grandparents' generation embraced and tried to instill in their descendants. One was not to belittle, demean, talk down to, or call other people names. Trump has consistently ignored that advice, while a large number of Americans still support him, and the number who voted for him far outpaced any other Republican presidential candidate or incumbent president. It wasn't enough. The reason can only be his personality. Most Americans expect a certain amount of dignity emanating from one who temporarily holds our highest office. Could Trump have achieved all he has without the name-calling? I think so. At a minimum, he might have resurrected a quote from a man who knew plenty about enemies, all of them domestic. I've referenced Abraham Lincoln's first inaugural address before, but it's worth remembering, even memorizing. At the dawn of the Civil War, Lincoln said, quote, "We are not enemies, but friends. We must not be enemies. Though passion may have strained, it must not break our bonds of affection. The mystic chords of memory will swell when again touched, as surely they will be, by the better angels of our nature," unquote. Could such an attitude have delivered a second term for President Trump? It might have swung enough votes to him from people who place a high value on deportment. Republicans can continue to embrace Trump's policies while getting behind someone without his baggage. Who might that be? My view of the perfect candidate is Vice President Mike Pence, who's been loyal to the president without the name-calling while preserving his own personality, dignity, Christian faith, and kindness. Republicans could do a lot worse than Pence, but not much better. I'm Cal Thomas.
You've been listening to the Fox News Rundown. Stay up to date by subscribing to this podcast at foxnewspodcasts.com. And for up-to-the-minute news, go to foxnews.com. Did you hear the news? Now you can. With instant updates from Fox News for Amazon Alexa. Just say,
Alexa, play news from Fox.
In Fox News.
It's the latest when you need it, on demand, from Fox News and Amazon Alexa.
Love Fox News? Click the subscribe button to get more of the news and opinion you trust. And click the Fox News Rundown playlist for the latest episodes.